we had this question come in that said there is really not many resources out there for coders in wound care, and it's a very busy department with lots of hurdles to go through for payment of these services. We have skin substitutes, HBO treatments, debridement, even just coding the diabetic ulcers themselves with ICD-10 codes that don't reflect the Wagner Grade system by my providers use. It can be a nightmare, and that is true. Keep in mind that we've got a lot of requests out there for more information on wound care, and after talking to Chandra, we decided that we should divide it up into segments. So we'll do this topic of wound care more than once, but we'll do it in categories. So tonight I'm going to talk about skin substitutes. Now, to be able to code the skin substitutes, there's some things you need to know about them. And the first thing you need to know is the definition. What constitutes a skin substitute? And it's actually used for covering wounds, which could be ulcers, but most of the time people think about burns. And so what I did was I focused on the different types of skin substitutes, first with burns, and then I did a little bit of information on the coding that goes along with skin substitutes, where we would start. We can go in more depth later as we add more content, but again, I could talk all night on this. There was so much information. Know that you, in the definition, that there's two types. Go back up just a little bit, Laureen. Those two types that are terms you need to know is the full thickness skin graft and I'm going to say this differently than other people say it. I call it autologous, which is not the proper way to say it, but that's think auto and then load. Anyway, that's the two main types because they're convenient. Okay, now we can scroll down. And again, there's other types of wounds that might need skin substitutes. But the things that you need to consider for first saying burns is, and this is all stuff that's going to be in the documentation, okay, that's going to tell you that you're going to be coding and using skin substitutes. But this is the stuff they need to know. They need to know the depth. They need to know the availability of a donor site. The problem that comes with that is that, you know, if you have a person that has burns over a large part of their body, where are they going to get a donor amount of skin to lay there? And then you have to worry about the wound that you're creating when you take skin from the other area of the body, the donor site. Infection, always a problem with burns, but especially when you're trying to put something over a burn or a wound, and a skin substitute would be doing that, would be covering it up. Where are the burns? You know, can you do a skin substitute there? Contracture. If you've ever seen anybody that has scar tissue from a burn or a wound or in an ulcer, you're going to see a lot of scar tissue, which can contract and literally make you lose function of fingers or different parts of the body. The aesthetic outcome, is it going to just look worse than letting it heal and from the inside out, I guess you could say? That is something to think of. The cost, you know, is it a possibility? Is this a relative cost? Time consumption, and you know, how long is this going to take? But a big one, what if there's nobody in your area or someone that knows how to work with skin substitutes? If you don't have somebody experienced, then you're probably not going to have a good outcome. So these are the points to consider when using not only for burns, but other types of wounds. Also, what is the skin substitute actually going to do for the patient? And this list, I'm not going to go through all of it, but just kind of have go over a few of them. The flexibility and the thickness is very important. Also, durable with long-term wound stability. Now, that is something that some people don't think about. This is all stuff that will be documented when you're talking about skin substitutes and if it's going to be effective or not. Again, cost is always something to consider. And this one here is a big one. Can it be conformed to irregular wound surface areas? So what if, you know, especially like on the face and stuff, think of the scar tissue, but there is also different colors that would be involved, right? And so you want to think about that. And easy to be secured and applied. You know, is it going to be easy to do, or is it an area that's going to be difficult? These are all things to consider when they're dealing with skin substitutes. Now, let's talk about quickly the classifications of skin substitutes. You're going to need to know these when you get into wound care. Before you even get into the codes that are involved, you need to bring up your knowledge base. First, we have a class 1. That's usually temporary. It's just a single layer, and that is something that is used to kind of cover it up so we don't get infection and letting the wound start to heal from the inside out. So we've got a single layer, and they've got a bi-layered type, and it's usually, it can be engineered material. Then a class 2 is a single layer of durable skin substitute. Again, they have a lot of companies that go with this, and where I got the resources from, they were great about listing these. You need to know as a coder, if you're working in the wound care, these brands, okay? These because a lot of times when you're dealing with even like HCPCS codes and stuff, that needs to be involved. So you've got epidermal substitutes, dermal, you've got lots of bovine and human as well. Okay, so let's go ahead and move down from the single layer, the class 2, and let's look at the class 3 is composite skin substitute. So this is where we're getting into a skin graft. This is also where those terms allograft and xenograft come in. If you don't know, autograft means it's from your own body, right? Think of, you sign your autograft. Auto means it's coming from you. Allograft means it's coming from the same species. So if you're getting a skin substitute from another person, it would be an allograft. If it's a xenograft, it's coming from another species. That's where you'd be getting this like bovine collagen sheet that would be used. It's not from a human, and they're laying that on top of the skin. Then we've got tissue engineered skin. These are different names of ones that are common, but again, it's tissue engineered. All right, we're developing the tissue ourselves, and then literally growing it and then putting it on the wound. Okay, as we scroll down, we keep going. And again, these are terms that are ones that you're going to want to know. Now, after we've got into that part, temporary skin substitutes, what do we need to know about them? These are usually, they're transient, psychological wound, you know, closure. If you got a big wound on your face, you need that covered up, and it's protection. You've got a physical barrier so that you don't get the bacteria in there. And for these wounds to heal properly, they have to have a moist environment, right? So that's important, and these temporary skins can do this. Uses for temporary skin, if you've got just dressing for the donor site, clean superficial wounds, let's see, provide temporary, again, just the look to not have something so yucky to look at. I guess that's not a good way to say it, but if you think about the different, especially like ulcers and burns, I thought this one was interesting. Sandwich graft technique over the widely meshed autografts, okay, and as a test graft for wound beds. This is interesting because you wouldn't have maybe thought about that, but if you've got a wound and they don't know if it's going to take, so we do a temporary little wound graft, see if it's going to take, and they don't like plop it down in the middle. They usually go on the side and the borders, you know, and see if it's going to adhere, if it's going to work. Permanent skin substitute. So we did temporary. Now we're getting into permanent, meaning it's going to be there and it's going to stay, right? And that's really what that means. Higher quality skin replacement. Again, we're not going to deal with the temporary that we don't know how it's going to look. It's going to be permanent. Now, let's real quickly look at some of the coding that would be involved with skin substitutes and how to look them up. The first thing you would look up is surgery, surgical procedure on the integumentary system, surgical repair or closure. That you didn't think about that, right? Because we're actually closing the wound by putting a temporary something temporary over it, and then procedures on the integumentary system, skin replacement surgery, and then surgical preparation. Again, these are things that you have to, this is how you're looking it up in the index, and then skin substitute grafts. So I went ahead and took from Find a Code these codes that I put in for the skin substitute, and this is what it brought up, and it starts at 15271, and notice that this is going to be a skin substitute, but it's going to be on the trunk, arm, legs. So when you're bubble and highlighting, that's part that you're going to highlight, is that it's the trunk, arms, and legs, and 100 square centimeters, first 25 square centimeters or less wound surface area. Okay, those are everything that you need to know as a coder. Those things will be spelled out in the documentation for you. And then as the codes change from 7.1 to 7.2 and so on, the size changes, and but you'll notice that on 7.1 through 7.4, we're still doing trunk, arm, and legs. Okay, but the 100 square centimeters stays the same, but we're 25 square centimeters or less, and then it changes again as we see the last part, or 1% of the body area of infants and children. That's all that little bitty tiny documentation that can mess you up when you're taking your CPC exam or another certification exam, and why bubble and highlighting is so important. Then we go down to look at 15275. We're doing no longer the trunk and the extremities, but we're doing face, scalp, eyelids, mouth, and then look, it's still going on. So we're thinking, think of the neck up, but also other areas that have smaller circumference. So we've got hands, feet, digits, genitalia. These aren't like the trunk and the arms, it would be large amounts. And again, but we go from the size, 100 square centimeters, the first 25 square centimeters or less of the surface area, and then as that is listed and changes, 7.7 is also mentions the infant and children. And so that's kind of just a quick overview on the coding. There's so much information about skin substitutes that we'll do more content in the future and build on this, but know that this is a good start. So next, after skin substitutes, we'll be looking at one of the other parts, the HBO treatment, the debridement, diabetic ulcers themselves. Oh my word, we could talk forever on that. So again, in a future webinar, we'll take another part of the wound care and we'll build on that knowledge base for you. And if you're in the replay club, you'll have it all.
Very good. Thank you, Miss Alicia.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.